Come to Lethbridge and join an innovative community for entrepreneurs. With more than a quarter of the 100,000 population under the age of 34, Lethbridge brims with energy. We'll help you to kickstart, innovate, and grow. Lethbridge, Southern Alberta's hub for innovation and technology. It's the bright choice for business builders. Go to chooselethbridge.ca/entrepreneur and we'll help you move and grow in Lethbridge.
Welcome to Canada's podcast.
Hello and welcome to Calgary's podcast with Mario Toneguzzi on Canada's Podcast Network. Joining me today is Dr. Emeka Nzekwu, who is the founder and CEO of Nations Vision in Calgary. Thanks for joining us today.
Thanks for having me.
Well, let me just start by asking you what Nations Vision is and what you guys do there.
Yeah, for sure. So Nations Vision is a subsidiary of Nations Health, which is an overarching larger organization that is designed and determined to provide portable healthcare services for priority populations, underserved populations, marginalized populations, locally within Canadian communities. And we started in Calgary. Nations Vision is the optometry, ophthalmology, and optical arm of Nations Health. And it is dedicated to the provision of affordable, equitable eye care services for priority populations. And so in a nutshell, we provide at this current time in phase one, portable services. So we provide services directly into low-income schools, directly into immigration centers, newcomer centers, homeless shelters, and so forth. And we provide, and senior homes as well. Mm-hmm. And that's where we provide most of our eye exams. And then we have a portable optical arm, which provides services basically anywhere, even in people's private homes, providing glasses and contacts and eyewear solution, directly to anybody who needs them, wherever it is that it's possible to get it to them at an affordable price.
When did you start this?
So Nations Vision was started in 2019. And originally we first started by going to Calgary Immigrant Women's Association, which is an immigration agency. And we provided services there for free for about 142 immigrant women. And that's what we started out with.
And give me some of the background of why you started this and, how this came about.
Yeah, so as a physician, I've kind of had, quite a prolonged period of time where I've noticed some healthcare disparities, some severe healthcare disparities amongst Canadians, particularly involving priority populations, underserved populations, marginalized populations. And the reason why, in a quick nutshell, is there's multiple factors, but one of those multiple factors is that the social determinants of health. People talk about it all the time. Social determinants of health are basically multiple different socioeconomic determinants and factors that affect one's health. It's not simply just, I have a disease, now I have this problem, now I have to get it fixed, I have to go see a doctor. It's multiple factors. And so there's multiple barriers for those individuals to access adequate healthcare solutions and services. And so what I noticed from a medical standpoint is we catch a lot of people who have fallen through the cracks in our system. Our system is designed one way to provide a solution to those individuals. And then when that solution doesn't necessarily work for them, or if that specific design doesn't necessarily work for them to enter into a healthcare system or access services, they tend not to, or when they do tend to, they tend to end up accessing the system at a point where it's a little bit prolonged, where the disease process or whatever is afflicting them is a little bit at a higher stage. And so that's why I decided to create Nations Vision and Nations Health to try to improve access to care, find people where they're at, and get them access to healthcare services, however that may be, whether that's bringing the service directly to them or decreasing the cost for them or what have you.
So tell me a little bit about the locations. Are you just in Calgary right now or elsewhere?
Yeah, so right now we're just in Calgary. We've been slowly looking to see what other cities have to offer currently, because obviously every city is kind of different, and the programs that they have to offer their their local populations and local underserved groups and so forth are all very, very different across Canada. We know we're going to try to first expand across Alberta and ensure that we provided solutions there. And then, of course, there's definitely other locations across Canada for us to provide services in. So we're really hoping to partner with a lot of agencies, partner with what people are currently doing right now, connect with different businesses and not-for-profits and charities, and ensure that we're able to provide solutions for their clientele and our future patients, basically.
So what's your background, Doctor?
So I am an interventional radiologist. It's my fellowship, actually. I'm in my fellowship right now, just about to be finished out here in Halifax. But I was born and raised in Calgary, and did engineering out at UBC and medical school at U of A and residency in Calgary. And here I am now in Halifax, and hoping to come back out west at some point. We'll see whatever happens. But at the end of the day, this is definitely, Nation's Health is definitely a passion of mine, and it's from from a small business kind of standpoint, entrepreneur kind of standpoint. It's just like a career passion. This is what I love to do. So,
yeah. What got you into medicine? Right.
So I actually, when from engineering, I always wanted to end up seeing if there was a way to bridge healthcare and engineering, because there's a lot of bridges to that gap. A lot of people have already done that. Technology plays a huge role in medicine, and the advancements of technology have played a huge role in the improvement of patient care. And I've always wanted to be able to be engaged with patients and healthcare and design. And so I ended up applying and wanted to help people, and I knew I always wanted to help people, even as an engineer. And this is definitely a way to get right into it and help people exactly with your hands on a daily basis, doing what I do, and I love it.
Tech Connect, a center for entrepreneurship and innovation in Lethbridge, has been springboarding entrepreneurs to success for 10 years and counting. Our spirit of innovation is a way of life. We have an incredible environment. Our innovators are not afraid to stand apart because they know that in Lethbridge, we are brighter together. We are Lethbridge. Come and join us. Go to chooselethbridge.ca/entrepreneur and we'll help you move and grow in Lethbridge.
So you mentioned the passion for this. Where did that passion come from for this particular area? And this,
for Nation's Health?
Yeah, and for the need for something like this.
Yeah, so I think that passion kind of came from my own personal experiences, family members, family friends, community members that I've seen either become afflicted by disease and or pass away on their own, from medical conditions that were actually quite, from a Canadian context, if you're born and raised in this country, were quite curable or quite preventable.
Yeah.
And that for me was quite difficult to see. And, over time, when you really get a chance to take a look and take a step back and think about it, it's like, why did that occur and why did this happen? And, you come to some solutions and to, some conclusions. And I feel like, once again, it's not necessarily, it's a cookie cutter system that might not necessarily always fit the need for everybody. There's a large percentage of Canadians that are affected by this, mismatch in the design of our healthcare system as a whole. I'm not talking about just the medical system. I'm talking about all factions, whether that's optometry, dentistry, physiotherapy, chiropractic therapy, medical therapy, pharmacy. All of those different factions face the same problem, and they present the same kind of solution for patients that doesn't necessarily fit everybody. And unfortunately, when people fall through the cracks, it affects their lives, it affects their livelihoods, the quality of their life, and the longevity of their lives too.
So what, as a doctor, where do you find the time to do a sideshow, so to speak, and being an entrepreneur?
So I get that question quite a bit. You kind of just you have to have your priorities. And, a lot of people have always said, if you want to do something, and you'll find the time to do it, and you have to focus on it. And this is my passion. So, I mean, for me, I don't even feel like it's a time-consuming endeavor. I do it after hours. I'm here in the hospital right now, and you caught me on the way out, and I was just about to try to get myself home and then comfortable, and then, but yeah, that's just how it works. You know what I mean? I gotta, do things after work, take the time to, pursue these passions, and they are related, right? I mean, I'm a physician here, and I do interventional radiology, is kind of a surgical kind of crossroads between surgery and interventional radiology, but it's related. I'm involved in trying to improve care or access to care for patients. And in the end of the day, when a patient sees me here in the hospital, they've already transgressed multiple levels of primary care.
Yeah.
So it's like I'm seeing them at the end, and then I see them, I'm trying to help them at the beginning.
Yeah.
And, so that they don't have to see me at the end, kind of thing.
So what do you like about being an entrepreneur?
So, to be 100% honest with you, I don't have any actual background in entrepreneurship or business or anything. You know what I mean? I just really, I quickly realized this is something that needs to get done. And how do I best do this? I got to start a company. I got to start a business. I got to create a business model. I got to do all this kind of stuff. The one thing I really love about being an entrepreneur is recognizing the limitations of your own knowledge, recognizing the limitations of my experience and my education. Engineering, healthcare doesn't train you to become a business, entrepreneur or what have you. However, it allows me to use something that I've learned a lot, which is in medicine. I've learned a lot about collaboration and multidisciplinary work, and leaning on other people who have skill sets in other areas to get the job done. And be that an interventional radiologist or his nurses and his techs, his or her nurses and his or her techs, that's that kind of collaboration. But whereas in business, I'm leaning on marketing, I'm leaning on my promoters, I'm leaning on my accountant and lawyers, I'm leaning on all the partners that are involved, whether that's school districts or not-for-profit CEOs and CEOs. Like, it's that engagement which I love, and that's what I find the funnest part.
Okay, super. What's the toughest thing about being an entrepreneur for you?
Toughest thing about being an entrepreneur easily, I think one of the hardest things that I've come to recognize is also on that same point, is recognizing your limitations and realizing that you can't do it on your own, realizing you constantly have to ask for help, realizing you have to lean on everybody, even though you would love to have that kind of independence to kind of push through, and recognizing at the end of the day, the last thing you want to do is hurt somebody. The last thing you want to do is make things worse for the patient population or clientele that we serve. And so it's trying to be a perfectionist at the same time as trying to get things done, and having that kind of balance of making sure that you can get things done at the same time as do them properly.
Yeah. So being a doctor, being an entrepreneur, does that give you any time for anything else?
I think so. I like to think so.
What kind of things do you like doing?
Well, hiking, being from Calgary, being from the prairies, I loved hiking, being out in the mountains, camping with friends. Really enjoy spending time with my family, and going out to restaurants, particularly here in Halifax, great restaurants, great bars. I've enjoyed my time here in Halifax quite a bit, and people are great, and I enjoy spending time with people. So.
Okay, super then. All right, well, thanks for joining us today.
No, well, thank you so much for having me. I really appreciate it, and glad that you would consider having me on your podcast and talking about Nation's Health, talking about Nation's Vision, and being an entrepreneur.
All right, super. That was Dr. Emeka Nzekwu, who is the founder and CEO of Nation's Vision here in Calgary. This has been Calgary's podcast on Canada's Podcast Network with Mario Toneguzzi. Thanks for joining us today.
Bold, vibrant, technological. In Lethbridge, our spirit of innovation is more than just the way we do business. It's the way we live and the way we succeed. We'll help you to kickstart, innovate, and grow in Lethbridge, Southern Alberta's hub for innovation and technology. It's the bright, affordable choice for business builders. Go to chooselethbridge.ca/entrepreneur and we'll help you move and grow in Lethbridge.